My name is Jim Sutton. I'm the Director of Community Medicine for Rochester Regional Health. Rochester Regional Health is a large health system in upstate New York. I also direct the Rochester Regional Refugee Healthcare Program, which is a primary care healthcare program for newly arriving refugees in Rochester. So over the last 30 years, there's been about 70 to 80,000 refugees a year resettling in the U.S., about 4,000 to 5,000 resettle in New York State, with 96% resettling in upstate. So our particular area, Rochester, New York, we have about 800 a year resettling. Refugees are a very interesting group of people who have really struggled. They've been displaced from their original country, often lived in refugee camps anywhere from 10 to 20 years inside a barbed wire camp. And then they get this opportunity to resettle in a neutral country. And very patriotic people. The first thing they want to do is become a very good U.S. citizen. They want to work, they want to pay taxes, they want their kids in school, they want to vote, they want to be a part of their community. There are some challenges to refugees entering into healthcare. We tend to look at these challenges in three categories. There's the individual patient challenges, that is, they don't know English yet. They don't have transportation or don't know how to get transportation to their appointment, and they're very unfamiliar with the Western style of preventive health services. There's challenges on the provider side of working with an interpreter or having the right cultural competency to take care of this patient that perhaps has been living in a refugee camp for 10 or 15 years. And then there's system-wide challenges of how do you sustain a program, how do you develop a program in such a way that it's meeting all these challenges, that it's overcoming all these barriers. And so we wrap this all together into a model that we presented to the New York State Health Foundation, and they gave us some seed money to pilot this model in 2009. We developed some cultural competency training for our providers and educational opportunities on how they could deliver better care. And I think most importantly, we developed systems or put the systems in place to help the individual refugees themselves overcome these barriers, such as assigning them to patient navigators or peer counselors or other previously resettled refugees that can kind of help them get through the system, have them understand how to fill a prescription, have them understand how to access public transportation, and how to kind of ease that burden of a new refugee coming into Rochester obtaining the healthcare services that they need. So through this model, we've been able to serve approximately 6,000 refugees since 2009. These are refugees that normally would not receive quality healthcare services, so we find that to be our #1 outcome in terms of doing something good for the community. We have been tracking other what you would consider normal quality metrics for patients, such as ED use, hospital readmissions, percentage of diabetics to goal, percentage of hypertensive patients to goal. And we found that in all of these metrics, our refugee patients have been doing as good or better than similar patient populations. Rochester has somewhat become now the epicenter of how do you deliver quality primary care services to refugees. The New York State Health Foundation took a chance on us back in 2009, and they didn't have to. They recognized there was an issue. There was a problem with refugees getting access to quality primary care services, and they saw where we had an idea. It's been a great funding operation for kind of a startup operation that we can now look back, 8, 9, 10 years later, that I think it has a legacy that will be around forever.